Welcome back, and very simply put, their role in emergency care can make the difference between life and death. I'm talking about paramedics who can perform life-saving interventions before patients ever arrive at a hospital. Programs are key to their critical thinking in those emergency situations. Joining us this morning to talk about a new paramedic program is Hartford HealthCare's Wes Young, EMS Director at St. Vincent's Medical Center in Bridgeport. Wes, great to see you, and let's talk about this brand new program. What really makes it stand out from the rest?
Good morning. Thank you for having me today. So our new program here at Hartford HealthCare St. Vincent's Medical Center is a 55-week immersive program that's going to provide training to the paramedics in the robust field of emergency medicine, talking about all different topics that they could see in the field.
Now, we're talking about 55 weeks. Is that a longer or shorter time period than most programs?
So most of the programs across the country run anywhere from 12 months to 16 months. So ours is on a little bit of the shorter period, but it still provides the extensive training that the paramedics need. But the goal is to get our paramedics out there faster to help with the shortage across the country.
Now, if we have somebody watching this segment right now and has an interest, what should a potential student expect when they come in?
Absolutely. So the paramedic training is very rigorous. It provides a lot of instruction from the classroom setting to the hands-on experience into the clinical and field setting. The students will do a lot of classroom work, but then they also go to 10 different locations throughout the hospital to learn everything from airway management, labor and delivery, ICU care, emergency care, and then they work with ambulance services all across the state to get their field experience of how to actually work in the back of ambulances on scene.
Wes, this is such a critical and important field that we're dealing with here. Is there a great demand for trained paramedics at this point?
There is. Across the state and all across the country, there continues to be a shortage of paramedics out there in the field. So the 3 different programs here at Hartford HealthCare and all the programs across the state are working hard to get these paramedics trained and out into the field to help the communities that we serve across the state.
So Wes, I guess it's fair to say that if you have a well-trained paramedic, somebody who goes through a program like yours, their job opportunities are going to be looking pretty good, correct?
Absolutely. There is a large need for paramedics across the state, and all of the programs that are training paramedics, the demand is much more than the supply. So the more paramedics we get out there and get trained, the more they're going to be in our communities helping the citizens on scene for those critically ill and injured patients.
Wes, let me take you out with this. What do you want us to know about paramedics that we might not know, average person might not know about the job or the people who do that job?
Paramedic training is one of the best fields in emergency medicine. We get to experience people in their residence, in their scenes. We're the first ones that go on scene to take care of patients. It is very rigorous training, rigorous job, but it's also very rewarding. This type of a training is unlike anything else in emergency medicine. It doesn't only teach you how to be a good provider, it teaches you confidence, teach you how to be a leader and how to serve the communities and provide access to care everywhere to our health systems.
Yeah, and great to know that people have saved lives in that job as well. Wes, we appreciate it. Thank you so much.
Thank you.
All right.
Have a good day.
You as well. And we're back with more of Good Morning Connecticut after a short break.